with an update on where we stand for this upcoming open enrollment. I'll begin by providing you with a little bit of a background on kind of where we stand this far into the implementation of the ACA, talk to you a little bit about how we supported the producer community last open enrollment, and then walk you through some of the improvements we have planned for next year. Happy to talk a little bit even about some of our plans already for 2018 for open enrollment 5. We're starting to discuss some of the IT improvements we have planned, so I'd be happy to chat with you about those, or if you have suggestions, you can always shoot those over to Renelle and she can get them to me. So with that, why don't we go to the next slide. All right, so let me talk a little bit about where we stand after last year's open enrollment. So we had a very strong open enrollment last year. We had record enrollments, as everyone is aware, and as a result, we're optimistic and confident about the health and stability of the marketplace. Thousands of agents and brokers assisted millions of consumers find quality, affordable coverage through the marketplace. And this is really significant. As I've been talking to other people, you know, the numbers don't lie. Brokers have been the main driver of enrollment when there's an in-person assistance involved. So yes, we have a call center that can help people. We also have navigators and other assisters, but the vast majority of in-person assistance is provided by agents and brokers. People now are seeing that data. It's been consistent for the last couple of open enrollments, and as a result, myself and my team advocate on your behalf as possible so that we get even more consumers, American citizens, enrolled in marketplace coverage. The good news is that 70% of customers who returned last year shopped for a plan. And we know that you all are trying to make sure that consumers are getting the best value and the best plan for their needs, and you help them shop for a new plan. It's not just a matter of auto-enrolling them. In every case, we know that people want to review their options to make sure it makes sense. So thank you for helping consumers shop and make sure they're in the right plan and they're getting the best value for their particular needs. In addition to record enrollments in the marketplace, customer satisfaction with the marketplace is also up. As you all know, we had a rocky start that first open enrollment. Things have steadily improved since we went live in 2013 for that first open enrollment. We haven't perfected everything. We still have a lot of work to do, but we're in a lot better shape this year as we go into our next open enrollment. Next slide, please. So here's the bottom line number. 11.1 million consumers effectuated their coverage during last open enrollment. So we're really excited about that number. It's not as big as our original expectations. I think a lot of that has to do with the fact that many employees and consumers ended up staying with their employer-based plans. But still, this is a record number for marketplace enrollment. We expect this number to increase over time. But as of last year, we had 11.1 million effectuated enrollments. 85% of consumers, and this is the key part, 85% of consumers qualified for at least some level of financial assistance. And that's really the main driver of enrollments. Affordability is the main barrier to people signing up for coverage. If we can make it more affordable with your assistance, explaining that to consumers, that's why we were able to get so many consumers enrolled. Next slide. So let's talk a little bit about kind of how things are different from that first open enrollment 2013 to today. The bottom line is that about 20 million fewer people are uninsured. And as a result, we are at the lowest uninsured rate in recent history. We are at 9.1% of consumers are now uninsured. That's still a number that's too high in our estimation. And what that number means, or what that percentage means or represents to you, is to grow your business even more, because there are millions of consumers that remain uninsured. But we are at a record low since we all started this effort in 2013, 20 million fewer uninsured. Next slide. So, I mean, again, the main reason why people don't have coverage is because they can't afford it. Affordability is the main driver of marketplace enrollments. In the vast majority of cases, 7 of 10 cases, consumers are able to get coverage for $100 or less when you factor in their advanced premium tax credit. So again, affordability is what's driving enrollment, and you explaining to consumers that affordable options are available in combination is why we're at record uninsured rates for this year. Next slide. Okay, so let me talk to you a little bit about how we supported the producer community last year during open enrollment, our third open enrollment. Because we were notified by you, the producer community, that there was a problem in some cases where national producer numbers weren't being sent over to issuers on the enrollment transaction files. We investigated the issue and did find that there was a small issue, and we fixed it immediately. It was a pretty fast turnaround from diagnosis of the problem to fixing it. That problem no longer exists. This really kind of underscores the need for us, if you're having problems with the system or something isn't working the way you think it should be working, make sure you're letting us know. There's a variety of ways you can communicate with us directly. I'll be giving you my email address at the end of this presentation. You can also send your questions, concerns to Renelle, and she'll make sure that we get those. We speak with Renelle on a regular basis. Last year, we also added a dedicated call line to assist agents and brokers with training, registration, policy, and other marketplace-related topics. Now, this is not the call line that can assist with consumer-specific issues, but we did feel like, in addition to the email help desk we had in place, that we would add a dedicated agent broker call line so you can get some of your training, registration, NPN policy-related questions answered more quickly. Although we are pleased with our turnaround on the email responses, it is going to take longer to get a response when you're emailing versus calling the dedicated line. I'll be providing at the end of this call. We also made it easier for consumers to find an agent or broker on healthcare.gov. So basically, if you're registered with the marketplace for SHOP or the individual marketplace, you've taken our training and signed our privacy and security agreement, you will show up on healthcare.gov and consumers will be able to find you. So that was one improvement we made last year. We also added functionality so that agents and brokers can make changes to customer policies when using an issuer site or another source. So previously, if you used an issuer site to enroll somebody or a third-party website such as a web broker, you weren't able to make updates on that site, from that site. Last year, we made it possible for you to do initial enrollment on the alternative website and also make changes. So that was an improvement we made last year. We also added a number of decision support tools such as Doc Finder, Provider Facility Finder, so helping make sure that a plan covers the doctor or a hospital is in network. We also added an out-of-pocket cost calculator to healthcare.gov. And then finally, we made it possible for agents and brokers to receive state licensure credit from marketplace training. This year, we have 2 private vendors. Last year, we had 3. This year, we have 2. So it's possible to take our marketplace required training for the individual marketplace and receive CEU credits for state licensure requirements. We have CEU credits available in all 50 states. and the District of Columbia. So if you're looking to get your CEU credits, you are able to pay a nominal fee to the private vendors and receive CEU credits and get signed up for marketplace registration at the same time. Next slide. So let me just tell you, before I talk about some of the improvements we have for next year, let me tell you about some of the key dates. These dates are identical to last year. I know that some of you would wish that we didn't have everything lumped towards the end of the year, but open enrollment again for the marketplace this year will be from November 1st, 2016 to January 31st of 2017. So it's the same time frame as last year, same critical deadlines. December 15th is the deadline for January 1st coverage. January 15th is the deadline for February 1st coverage. And January 31st is the deadline for March 1st coverage. I can't stress enough how important it is to make sure you're not waiting till the last minute to sign people up for these various deadlines. In particular, the busiest time by far has been consistent from the first open enrollment all the way through last open enrollment. It will be December 15th. That's because a lot of people want to have January 1st coverage effective date. So my advice to you when we go live on November 1st is to enroll as many of your customers, your existing clients, enroll new clients well before the December 15th deadline, because if you have any problems that need to be resolved, you don't want to wait till the last minute. Our call center receives, I think on that day, it's well over 1 million calls on that day alone, leading up to December 15th. So you want to avoid that time unless you enjoy standing in a long queue to speak to a call center representative. So please don't wait till the last minute to sign up your customers. I'm pleased to announce that registration and training for this open enrollment is live. We opened on August 1st. Things are working fine. We had a couple of small bugs that we have worked out since our go live, but generally we've registered thousands of brokers already. People are getting registered and trained for this upcoming open enrollment. Let me remind you that in order to enroll a customer in marketplace coverage and receive compensation, you must be registered and you must re-register every year. I realize it's a bit of a hassle, but it is a requirement that's in our regulation. So every year you have to come back in and take our training for the individual marketplace and sign our privacy and security agreements. Now, if you're looking to sell just shop, or if you're taking the training, you might want to just sign the privacy and security agreement for shop as well. Shop is we don't require training for shop. We have it available if you want to do it, but it's very easy to complete the shop requirements by signing a privacy and security agreement. I really would encourage anybody who takes the individual marketplace training to just sign the privacy and security agreements for shop. The benefit of that is you will be displayed on healthcare.gov and on the shop portal for employers so that your name will display, and you might get some phone calls for people looking to sign up for shop marketplace coverage. Again, the training is live. You can sign up by going to the CMS site. I'll be giving you that web address in a little bit. Or you can go to 2 private vendors this year, AHIP and NAHU, have trainings available where you can get CEU credits. The training through CMS, and there's a fee if you use the private vendors. Next slide. Okay, I have 2 slides that are going to talk a little bit about some of the improvements we are making for this year. This is really exciting stuff, and I'm even more pleased about some of the things we have planned for next year. For the following open enrollment. So this year we're making training easier and more efficient for agents and brokers. We've streamlined the steps in the process to make sure that everyone knows the steps they have to take and that people aren't in a training gap. In the past, it was we did have a few people who didn't complete all the steps. we've made it pretty easier this year to not miss the steps. So hopefully that will get as many people through as possible, as quickly and efficiently as possible. The big news that we're happy to announce is that if you took training last year for 2016 year plan year and you want to sign up again this year for 2017, you'll be able to take a refresher training course, which is great because it'll cut down the time that you have to take the training by about half. We are focusing on the things we want to emphasize and reinforce, but a lot of the things we know you know, and if you've taken the training in the past, we're not making you sit through the entire training again. So you'll be able to complete the training in about half the amount of time, which I can tell you that about 90% of the people who are eligible to take the refresh training are taking it. So that's been a very popular enhancement this year. We're streamlining access to the marketplace call center representatives, and we're equipping the call center representatives with more tools and information to respond to your inquiries when you call the call center. This is really exciting, and in September we're going to be giving you more details on what this means, but the limited information I have from the call center director is that brokers this year, for the first time, will be able to contact the marketplace call center. They'll be able to enter a unique identifier. I don't know if it's going to be your NPN. We'll give you that information later. You'll be able to hit a prompt on when you call the marketplace call center. You'll kind of bypass all the consumers. You'll be put into a special queue for assisters and agents and brokers. You'll be able to enter a specific password or code to get in. We're not going to allow everybody in. You have to be a registered broker with the marketplace. So another reason to take the marketplace training. And then you're gonna have a set of dedicated call center reps, tier 2 folks that can answer some more specific questions about cases that you might be having problems with. So we're excited about that. We're going to be providing more information. We'll be sending that out to everyone who is registered with us. So again, register and you'll get that update when it becomes available. We're going to be allowing change in circumstances without having to generate a new policy. Now for many of you, I think you know what that means. Right now, we have a bit of a clunky process where if you make an update to a consumer's application, it could be something as easy as updating a telephone number or a mailing address. It ends up effectively canceling the policy and starting it all over. Moving forward, it'll be like the individual marketplace, like the shop marketplace where we have maintenance transactions already in place. And you'll just be updating the existing application, the existing account. So you're not going to be terminating or ending the policy and starting it over. You're basically going to keep the policy open, and we're going to be sending over a maintenance transaction on the back end to the issuers. They will update their system, so we won't be effectively canceling and terminating the policy. Let's see. We're making the web broker and the issuer direct enrollment channels more reliable. In some cases last year, people were dropping from the back-end connection with the marketplace, so that process should be more reliable this year. We're also adding search filters such as office hours and mapping capability to healthcare.gov. So essentially, consumers, for brokers that have registered again with the marketplace, you'll be giving us your business location, and when consumers come to healthcare.gov and want to work with an agent or broker, they'll be able to enter a zip code and a map will pop up, and it'll populate on a map kind of where brokers are located, so that if the person wants to meet in person with you, they might choose to work with somebody who's as close to you as possible. We'll also be adding office hours and a few other filters to find brokers that they are most interested in working with. So that's another enhancement. The next slide, we have a few more to go over. Okay, just a couple more things. I've talked to you about some of the new decision support tools that we put in place last year, Doc Finder, Prescription Drug Finder, and out-of-pocket cost estimators. A lot of those tools will be incorporated into the healthcare.gov enrollment flow this year. Again, it should make it easier for you to walk through some of the options so that consumers can make more informed decisions, so that'll be an improvement this year. As you know, we have two applications. We have the full classic application where it's the longer version of the application, and then we have a streamlined application. We call it App 2.0. The App 2.0, the streamlined version, will actually be even more streamlined this year, and it will also allow more consumers to use it than were able to use it in the past. So again, that should make it easier for you when you're coming in and working with consumers in the side-by-side channel on healthcare.gov. More of your consumers will be able to use the streamlined version of the healthcare.gov marketplace application. We're also improving some of the front-end self-service tools for consumers to reset passwords, remember usernames, and regain access to their accounts. So hopefully consumers will be able to do some of these things by themselves, and they're not going to be calling you to help them with some of these kind of account access issues. And then finally, we're making it easier for more consumers and you to use mobile devices to get people signed up for coverage. So for those of you who like doing things on iPads, etc., you'll be able to utilize mobile device capabilities to sign people up for coverage. Next slide. I'm not going to go over all of these. I just want you to know that we have a kind of a comprehensive list of tools and resources available for the producer community. We are in the process of updating our agent broker resources page, but all the information is already there for you. If you're new to the marketplace or you want to learn or just be reminded about some of the resources that are available, you can always go to healthcare.gov, just type in healthcare.gov. On the lower left-hand corner of the homepage of healthcare.gov, there's a link that says for agents and brokers. If you click on for agents and brokers, you'll come to the agent broker resources page where we have a lot of our regulations, a lot of our past trainings, all of our past newsletters. We also have the list, the registration completion list. If you want to see if you are on the registration completion list, and that's the list that issuers have to make sure you are on before they are able to pay you. Now the good news is this year we have the registration completion date as well as the start and the end dates of when you took the training. Sure, all of that information is accurate. The other improvement we've made to the registration completion list, again on this agent broker resources page, is we have included all the plan years. So sometimes there's some confusion about whether or not somebody was registered for one plan year versus the next. So now we have basically made it possible for you to see all of your registrations, completions, all in one file. And issuers will also have access to the full file. It's just going to be easier for you to sort and to display all of your information in one file. Again, all of that is available on the resources page located by going to healthcare.gov, lower left-hand corner, clicking on for agents and brokers. There's also a number of resources, consumer-facing information on healthcare.gov that will be helpful for you as you work with consumers. And also marketplace.cms.gov. If you haven't been there before, I'd really encourage you to go to marketplace.cms.gov. There's a lot of great information on there for you, and would encourage you to go there. A lot of consumer-facing information that you can use when you're working with your clients. The other thing I want to point out on the agent broker resources page is that there's always questions about how brokers or if brokers can work with the navigator community and the assister community. And the short answer to that is yes, you are able to work with navigators and other assisters. We have set some ground rules and some guardrails in place, but you are able to work with the navigator and assister community, and a lot of great relationships have been formed with the navigator and the assister community. On the Agent Broker Resources page, we do have a PowerPoint that talks about how you can work with the assister community and the navigator community. So you might want to check that out. Again, we also have newsletters available on the resources page, and we also tweet for those of you who have a Twitter handle. Next slide. So these are the two call-centered help desks that I mentioned, or the help desks that I mentioned. We have an email help desk, and that email address is up on top, ffm producer-assisterhelpdesk@cms.hhs.gov. And again, this help desk usually gets back to people within 1 to 3 business days. They can answer your questions about the registration completion list if you're not seeing your name. Again, give it a day or two for your name to populate on that list, but generally it'll populate within a couple of days. If you have identity proofing issues, you're a first-time user and you've gone through the identity proofing process, and they can answer your questions. If you have find local help issues, and that's the tool on healthcare.gov where consumers can find brokers. If your name isn't displaying correctly, or you have questions about that, how you can make updates to it, you can email this help desk, and they can also answer some basic policy questions, not specific to a consumer application, but some basic high-level questions they're able to answer as well. As I mentioned, we have a new call center just for agents and brokers. It's a general number with a dedicated prompt. It's prompt number 1 for agents and brokers. We're open Monday through Saturday to answer your questions. They can answer many of the same questions that the email can. It's just you're going to get your responses more quickly. Next slide, please. So actually, these dates are now out of, they're outdated. But let me just remind you that we are finishing up all of the presentations for the training and registration process this year. If you missed the presentations we did on the training and registration process for the upcoming open enrollment period, don't worry, you can go to the Agent Broker Resources page I mentioned. Again, go to healthcare.gov, lower left-hand corner, click on for agents and brokers, and you'll be able to find 2 presentations. One of them is dedicated to brokers who are new to the marketplace. So you will have to take the full training this year, but we'll walk you through all those steps in that presentation on the resources page. If you are a returning broker, you registered with us for the last plan year, you'll be able to take a streamlined version, and we have a presentation that walks you through the streamlined version as well. All of the information is available on the Agent Broker Resources page. So if you missed our webinars, you are able to download the information and find out how you can register for this year. Next slide. So this is just a training overview. I won't go over this. I would imagine Ronell is going to be making this available to all of you. But in order to start the process, you'll need to go to the CMS Enterprise portal, and the address is up on top. And again, all of this information is available in the more detailed presentations that are available on the Agent Broker Resources page. Next slide. So let me bottom line this for you, and then I'll give you my email address, and we will then take your questions. So again, why should you consider participating in marketplace this year, both the individual marketplace as well as the shop market for small businesses generally with 1 to 50 employees? So the answer to that is quite simple. Even though we are at record low uninsurance rates across the country, we still have 9.1% of the population without insurance coverage. That's a lot of people. Millions more consumers and small business employees remain uninsured. And as you know, most of the uninsured are working, and they work for small businesses. So if you're looking to figure out how to reach the uninsured, you might want to start with your local communities and your small businesses, but millions of consumers and small business employees remain uninsured. New tools and streamlined enrollment processes are available for you this year. As a reminder, the same commission is required to be paid to you on the marketplace as is paid off the marketplace. The tax credits for both marketplaces, small businesses and individuals, help to keep marketplace plans more affordable for consumers and small business owners. As I mentioned, we have an easier and shorter agent broker registration process, so don't let the thought of taking a multi-hour training get in the way. We've made it easier for those of you returning this year, so please take care of that training well before November 1st. And then just a reminder, you can register today, finish it. We're open, the training is available 24/7. We have very few maintenance hours, but it's generally available throughout the day. So if you're having problems sleeping late at night, you can go online, take our training, knock it out, and then within a business day or two, your name should appear on the registration completion list. You want to make sure that it does, and if it doesn't, make sure to send us an email or call us at that agent broker call line, and we'll investigate why it's not showing there. Next slide. So actually, looks like my email address isn't in there. If you have questions outside of this call, I mean, we'll take your questions now. You can always send them to Renelle. She knows how to get a hold of me, and I'm happy to answer those questions. We'll make sure to respond to them. But in the meantime, we have about 25 minutes. I am free until noon. I'd be happy to take any of your questions right now. Renelle, I'm going to turn it back over to you, and you can either ask it in the chat or open it up however you'd like to handle it.
Sounds great. What we'll do is go over some of the questions and comments in the chat box, and if anyone would like to talk to Dean, just raise your hand and I can unmute you. Deborah from Florida said that many agents employ assistants to help with retention, etc. The CAC training program would be a great benefit to the assistants working under a licensed agent. Can this program be opened up to those not affiliated with a not-for-profit organization? And I know this is something, Dean, that I talked to you about, and you did connect me with someone at CMS to see if possibly HAFA could help those people become educated, and it really didn't go anywhere. So I'm not sure if you have a comment about this or not.
Can you just remind me, Renelle, what this is? These are people who work for who again?
People that would be staff, so people that work for agents, and they would want them to get the CAC certificate, so they were educated about the ACA.
Well, one of the things that we are looking to do in the future, and I would assume it would be for next open enrollment, is we want to make it possible for non-licensed brokers to take our training. So the marketplace training that we make available for brokers, we are planning to make it available to non-brokers moving forward, because we know that there are a lot of people such as staff who aren't licensed at a brokerage firm, and quite frankly staff at issuers, insurance companies, who also want to be educated. And we want to make sure that people who want to learn more about the marketplace can, because we know there's a lot of people supporting the broker community. So Renelle, if we did that, would that address the concern for the longer term?
I think it might, and we can circle back around with our folks and make sure, but we can let them know that. Wayne from Louisiana says, is there any talk of eliminating the spouse penalty? In other words, the spouses refuse the subsidy because they get coverage through their employer, but it's really not affordable.
Yep, that's kind of, I forgot what we call it, the spouse loophole, or the family glitch. I'm not
Right,
forgetting what we call it these days.
unintended consequence.
Okay, so that's an item that's written into either the, I'm assuming it's written into the statute. So because it's a it's in the statute or in the law, that's something that really would have to be taken up with Congress and would have to be fixed at that level. We don't have the ability to not implement the statute the way it was written. So that, if I'm understanding the question and the problem, is that something that really does need to be brought up with with Congress. And so again, assuming I'm getting that right, I mean, I would encourage you to raise your concern about this to your members, your representatives in Congress, and your senators in Congress, and share with them your concerns about this, because we are implementing the statute. We don't have the authority to change the rules that are in the statute.
Thank you. I absolutely agree, and that's something that we have been trying to talk to those on Capitol Hill about. Wayne from Louisiana also says that the CE credits are not approved in Louisiana for the NAHU and the AHIP program, so I'm assuming that's probably something we need to work on.
Well, let me, I guess my statement that, the CE credits were available in all 50 states and DC, that was the case last year. I think in some cases, NAHU and AHIP are still in the process of getting CE, their approvals from the state. So I think there might be a few states right now that are still open, but my understanding is that both of those organizations plan to do that. I'm going to follow up with you, Renell, and just to clarify that, but my understanding is there will be CEU credits available in Louisiana and in all states. It's just that it's a bit of a timing issue. In some cases, the applications are still pending with the states.
Okay. Linda says, when a consumer goes to healthcare.gov to re-enroll for 2017, does the agent information get repopulated into the new policy? And I think this is the glitch that happened last year that I'm hoping that you just said was fixed.
So what is supposed to happen, and I'll tell you, what I want from the community if there is a problem. What is supposed to happen, so when a consumer goes in to update their application, if an agent or broker is on the application, the information should be pre-populated from the previous year. We don't strip out the NPN information. Be there, and it should be passed over to the insurance company. Additionally, for those applications that are auto-renewed, so most people are coming in to touch their application. I think it's only 30% of applications were auto-renewed last year, or 70% of consumers actually went in to shop for a new plan. So that suggests about 30% didn't. For those that are auto-renewed, regardless of what the percentage is, the NPN should be sent over again on the application. So there should be no system issue with that not happening this year. We still encourage brokers to go in, whether it's side by side from healthcare.gov or on an issuer site or direct enrollment channel through a web broker, to still go in and make sure the plan still works for the consumer. But if no action is taken, the NPN should persist, and it should be sent over on the enrollment transaction to the issuer. So that problem seems to have been addressed. Now, for all these issues, every so often we hear about a problem or an issue, and in many cases there is a reasonable explanation of what happened. So if you have any concerns, and Renell and I have worked on cases in the past, we really need you to send us some identifying information if it's PII, personal identifiable information, we need to password protect it, or Renell can call me and I can write it down. We can't be sending information over email. But, you know, get us the information. The safest thing to do is send us the application ID. Don't really like consumer names or birthdays, but if we need that information, you know, we'll get it. Somehow we'll get it to us securely, and then we'll investigate what happened. So if you're saying an NPN dropped off, we want to investigate what happened, because if there's a system issue that we don't know about, we want to know about it, and we'll try to resolve your issue. But more importantly, we want to make sure that it gets resolved. The bigger issue is resolved for everyone else as well. So please send us information. Another thing, every so often we get a complaint about a call center representative. I think most of them are hardworking and they do a good job. In some cases, you know, especially when they're receiving 1 million calls a day, you know, things don't always happen and people aren't always at their best. If you ever have a concern or a call center representative, again, if you could give us the time of day you called, and we need the application ID or the consumer name, something, and we record all of those calls and we can follow up. Now, it's important to know that we record all of those. You know, it's much easier, as everyone on the call knows, to get good service and to get friendly service when you yourself are friendly. Again, I can't tell you how many calls we've listened to where brokers are screaming and yelling and being incredibly disrespectful. That's you know, kind of not the majority of cases, but it's easy to understand why representatives react when, you know, they face that kind of treatment. So again, all the calls are recorded. Let's keep that in mind. And if you have any concerns or questions about a particular representative, give us some information so we can research the call, and we'll pull up the recording and we'll try to resolve whatever the issue is with that particular representative. That was a long answer, Renell, but I'll take the next one.
Okay, Dean, has there been any thought to assigning an identifier to the marketplace representative? So in those cases when something does happen, either the consumer or the agent can say, you know, marketplace rep number 333 was the person I talked to.
I don't know. I would imagine all of them have an identifying number. Let me bring that up with Marketplace Direct. I would imagine they all already have a number, and it's just a matter of the representative communicating the number to the consumer or the broker. So let me take that as an action item, and I'll see if that's possible.
Okay, thank you. The next one is Ronita says, why is healthcare.gov defaulting everyone to receive notices through their healthcare.gov email account, even when the consumer has chosen to have the notices mailed to them? It appears this it changes the consumer's account every day, and they have the problem is it continues that the consumer will not get the important notices that many have set up the email just to complete the application.
So let me make sure I'm understanding the question. So the marketplace defaults to email, and so then some people aren't going into their account to check, or is it that people are opting for mail and they're still going to email? I'm not sure I'm understanding what.
Yeah, they're opting for mail, but they're just going to email. I know I've heard this complaint across the nation that the consumer saying, I never received this notice, and they're obviously being sent to the email address, but some of these people, of course, don't have, you know, email accounts. They just set it up to get their healthcare.gov application completed.
Well, that's right, but they should opt into mailed version.
But they're not receiving the mail.
Is the question, you know? Okay, I don't know what to say. And again, this would be something where if somebody had a particular consumer that has set up a mailed version, you know, they've elected to get their notices by mail, and they're saying they're not receiving them. Again, maybe there's something going on here. Maybe I mean, it's a production. We have to send over a PDF file to the mail vendor, and the vendor has to put the notices in an envelope and put postage on and get them out. So there could be a problem in that process. So we would like to investigate that. I will ask the general question to our operations folks about if they know of any problems. But if you have any specific examples, again, please send those to Renell, and we'll investigate to see if there's a bug that we aren't aware of.
Thank you. Then we have a question that says, can we discuss the problem that when people turn 65, they have to leave a dependent on the plan? The process is not working smoothly. In the last couple of weeks, I've had 3 clients with this situation, and the marketplace actually termed everyone, and we've been told now we have to resubmit an escalation that could take 90 days. Meanwhile, the plan is canceled, the subsidy is taken away, and the member has no coverage and cannot get their medications.
So we have a Medicare eligible person who is coming off because they can't have marketplace coverage, but they have dependents, and everybody is being terminated at the same time, and they have to be added back on separately. So there's a gap in coverage because of that. Is that the scenario?
Right. So it's a glitch where you're trying to take off one person, and instead of leaving the other people on, it terminates everybody.
Okay, I don't know much about that, but I'm writing it down, and I will follow up with our operations people and just finding out, if there's anything that can be done. But I'm noting that, and we'll bring it to our operations folks and our enrollment folks.
And here's one you and I have talked about a lot. Why are marketplace reps allowed to remove agents' NPN numbers? And I know this is something Dean and I have talked about. We need specifics. If you can send that to me, I'll be happy to send it to Dean. He needs to know when, what, where, and how, so we can find out exactly who's doing that. And Dean, if you want to add anything to that.
No, I totally want to add something. This is one that the marketplace director gets very defensive about because the standard operating procedure, it states very clearly that marketplace representatives are never to take off an NPN. That is what they're trained to do. Now, whether or not they're actually doing it, that's a whole other story. So again, they are not supposed to be taking off the broker or the NPN unless the consumer directs them to do that. If the consumer's in control of who they want to get credit for the enrollment. So if the consumer says, I'm sick of working with this broker, I don't want to be associated with them again, they have the right to take their needs and NPN off their application. So, but they are the only ones that should be doing that. If you are aware of a consumer or of a marketplace account where you think the representative erroneously took off your information, then we need to know, if you know the representative's name or the time that you called, or give us as much information so we can go in and investigate who did what and when, and we'll try to resolve that for you.
And then we have one more question and one hand up, so I'm going to ask you this and then let Wayne Shalhai ask you a question. He says, okay, if the client chooses to use an agent, is there any way to CC that agent on all communications? That many consumers ignore or don't understand the communication that they receive. So if we were CC'd, we could help that consumer.
So that's a really good question and a very good point. And this is one of the enhancements that I have put forward as a suggestion for 2018. I don't think we're going to be able to do that this year. And I don't know that it would be a C per se, but somehow I want to be able to communicate to the broker community for all your associated cases with the marketplace, what's the current status. So I don't know what the solution is. It might be just CCing you on messages. It might be giving you a dashboard capability so you can see, all of your consumers and if there's any issues with any of them. We're trying to work through that solution right now. We won't deliver this for this open enrollment, but we're looking to do that down the road. we are looking into that. The reason I'm hedging a little bit on the notices piece is there might be some privacy security issues. I don't want to commit to anything on what the solution is, but we are looking into that. One thing I would like to stress with all of you today is that you should never be putting information on the consumer's application. So for example, where it says, you know, preferred contact email address or address, phone number, it should never be your information. I understand why you might want to put your information in there, but that isn't a broker information, that is the consumer information. So we're working on a fix where you'll have more information down the road, but you should never be putting your information on a consumer application. How about that question? Is it from Wayne?
Okay, and then the last question, they'd rather me just ask it through the question box, is that there are some plans that are going to be leaving the marketplace, and we know there's going to be some auto enrollment and some mapping over to new plans. What is the process for mapping over to a new plan, and what if that agent isn't contracted with that new marketplace carrier?
I'm a little, yeah, I understand the question. I'm a little bit murky on exactly how the plans are crosswalked to the new plan. I don't know that. My understanding is the NPN will be sent over to the new issuer and the new plan. But I mean, if you're not, you know, if you don't have an appointment with the new issuer, I mean, that's something we can't control, and I understand that's problematic, why that's problematic. But that's something we can't, you know, we can't control. We would encourage you to the best of your ability. I know it's not always easy to get appointed with all the carriers, but we do encourage people to be appointed with as many of the carriers on the marketplace as possible. But if you're not, and that's who the consumer is enrolled in, then, you know, in all likelihood you won't get paid. Renelle, if I could just add one more point, because this question comes up a lot when I'm out in the, when I'm visiting with folks in the field. The question is, you know, do we really have to have the consumer call every year to be reauthorized for the call center? You know, they have our NPN. Why can't that just be the authorization so that I can call the call center on the consumer's behalf? It's really painful, especially when you have hundreds and perhaps thousands of cases if you work at a larger agency, for the consumers to have to do that. So I am sympathetic to that complaint and to that request, and I have put forward a few suggestions. What I will say is that we have some very strong security parameters in which the federal government adhere to, and reason to get up for every 300. What I am trying to do, however, is make it possible so that a consumer, instead of having to call the call center, they can somehow make the authorization online to their account. So I mean, that's not an ideal fix, but it minimizes the need to have to wait in queue to make the reauthorization self-serve online. So we're looking at a few other things as well. That's one of the complaints we get. We are, again, aware of the complaint. I also agree that it would be tedious, especially if you had hundreds of cases to have to be working into it, and we're hoping to have a solution. Not this open enrollment, so you're going to have to bear with us for this one, but I do have it on my wish list, if you will, for our IT development for 2018. Renelle, anything else that's come in?
I think I would just like to say that all independent agents would love to be contracted with all insurance companies. They control that, and they refuse to allow that to happen. So that's kind of the impasse. You can't help us, and they won't do it. So that said,
yeah, I know.
Yeah, I want to thank you.
Yeah, I know.
I know we have about a minute. From HAFA Agents, from agents across the nation, I just want to thank you for taking time out of your schedule to visit with us, because you said some things that were good to hear. That we have massive flooding in Baton Rouge, and it was worth putting on my hip waders to get to the office. I really appreciate everything you said and everything that you're doing for our industry. So, and everybody on the call says thank you.
You're welcome, and it's a pleasure to be on the call. Just for everybody who's on, again, you have a great advocate in Renelle. She lets me and the agent broker team and the marketplace CEO know about your concerns, so please continue to funnel those concerns to her. We can't always address all the concerns. We don't always have the answers, but if we have the information to investigate, we'll do it, and we'll, this isn't perfect. It probably never will be perfect, but we're trying to improve every year to make this better for you. So let's just keep the dialogue open and hope to make this even easier for you. The goal is to get as many consumers enrolled in marketplace coverage. Again, I'd encourage everybody, before the end of September, make sure you have your registration in place. You've taken the training till November 1st to get trained and registered. Issuers aren't going to pay you if you don't be registered. So take care of that this weekend as soon as possible for November 1st. So Renelle, it's a pleasure to be with all of you today. Thanks for having me on.
Thank you so much, and I will send this presentation out to everyone in our Monday morning news. But thank you so much, Dean, and have a wonderful weekend.
You too.
Thank you for all you HAFA members, and you guys be safe.